Beware of these 5 morning habits that increase your risk of falling after 70. Every year, more than 1 in 4 Americans over 65 experiences a fall, according to the CDC. And while many think these falls happen outdoors or during exercise, research shows that a large number occur within the first hour after waking, right inside the home. Falls are the leading cause of injury-related death among adults aged 65 and older in the U.S. The risk doesn't come from dramatic accidents, but from routine movements done without awareness or preparation. After age 70, the body becomes more vulnerable to sudden changes in position, hydration levels, and joint stiffness. Yet most morning routines remain unchanged for decades, unknowingly increasing the risk of losing balance during those first steps out of bed. In this video, we'll uncover 5 common morning habits that quietly raise the likelihood of falls in seniors. These are not extreme behaviors, but simple, everyday actions that, if adjusted, may significantly reduce the chance of injury. Understanding these risks and making small but deliberate changes can help preserve mobility, independence, and long-term safety. Let's begin. Getting out of bed too quickly. One of the most overlooked causes of morning falls in older adults is standing up too quickly after waking. After hours of lying down, the body's blood pressure naturally decreases. When a person rises abruptly, blood flow hasn't yet adjusted to the upright position, leading to a sudden drop in brain circulation, known as orthostatic hypotension. This condition can cause brief dizziness, blurred vision, or even fainting. While it may last only a few seconds, that's often enough to trigger a fall, especially when transitioning from bed to the bathroom on hard floors or near sharp furniture corners. It's not always about weakness, just poor timing between posture change and the body's circulatory response. This problem becomes more pronounced with age. As we grow older, the autonomic nervous system, which helps regulate blood pressure when changing positions, responds more slowly. In younger adults, standing up causes a quick signal to tighten blood vessels and stabilize blood flow. But in seniors, that signal weakens, and blood may pool in the lower body before the brain receives enough oxygen-rich circulation. One clinical review of fall incidents in assisted living facilities revealed a clear pattern. Many falls occurred within the first 15 minutes of waking, often in the bedroom or on the way to the bathroom. These are not isolated events. They reflect a physiological delay that builds with age and must be managed with new habits. The solution is surprisingly simple, but often ignored. When you first wake up, stay in bed for a moment. Take a few slow, deep breaths to activate circulation. Then roll gently to your side and push up into a seated position. Sit on the edge of the bed for 30 to 60 seconds. If you feel steady, then slowly rise to stand, ideally while holding a stable surface like a nightstand or handrail. Avoid multitasking during these first few moments. Don't immediately check your phone, reach for objects, or rush to turn off the alarm. Let your body orient itself fully before walking. This small pause can reduce the risk of imbalance more than most people realize. If you take morning medications that affect blood pressure, this becomes even more important. Some antihypertensives or diuretics may amplify morning dizziness if taken on an empty stomach or without preparation. Always discuss with your doctor whether your medications may be contributing to orthostatic symptoms. In some cases, using a supportive tool, such as a firm armchair near the bed or an adjustable bed base, can assist with safe transitions. Even small home modifications, like motion sensor lighting or anti-slip flooring beside the bed, can offer added protection. For many older adults, the morning mindset still follows younger patterns. Get up, get moving, get going. But after 70, it's time to treat those first steps of the day as critical, not casual. Stability isn't just about strength. It's about timing, awareness, and habit. And this is only one hidden risk within the morning routine. The next one might seem harmless, because it's something you're not doing. But your body notices. Let's take a closer look. Skipping water first thing in the morning. After a full night of sleep, the body naturally enters a state of mild dehydration. This isn't just a matter of dry mouth or thirst. Fluid loss through breathing, perspiration, and lack of intake over several hours can subtly reduce blood volume. For older adults, this loss has a larger impact, especially when it comes to maintaining balance and muscle function. Dehydration lowers the body's ability to regulate blood pressure and maintain equilibrium. When fluid levels drop, blood becomes more concentrated and circulation slows. This can lead to symptoms such as lightheadedness, weakness, delayed reaction time, and a sense of unsteadiness while walking. These effects are often amplified during the early hours of the day, before the body has fully rehydrated or warmed up. In seniors, the thirst mechanism becomes less sensitive with age. This means the body may need water, but the brain doesn't send strong thirst signals, leading to underhydration even before the day begins. As a result, many older adults unintentionally start their mornings in a state of compromised fluid balance without realizing it. Additionally, lower hydration affects joint lubrication. Overnight, joint spaces can become stiff due to reduced synovial fluid movement. Without adequate water intake, joints, especially in the knees, hips, and ankles, may feel tight or restricted, affecting gait and increasing the risk of instability or missteps during morning movements. Water also plays a key role in maintaining muscle strength. Even mild dehydration has been shown to impair muscle performance and coordination. For someone over 70, this may translate into reduced leg strength, slower step initiation, and less control when transitioning between positions, such as moving from sitting to standing or navigating the bathroom. To minimize these risks, it's important to make hydration a morning priority. Drinking a glass of plain water, ideally 6 to 8 ounces, within the first 15 minutes of waking, can help restore circulation, improve joint mobility, and reduce dizziness. It also supports digestion and helps the body process morning medications more effectively. Avoid replacing water with coffee or tea as your first beverage. Both are mild diuretics and may further contribute to fluid loss if consumed before the body is adequately hydrated. While it's fine to enjoy these drinks later, start with pure water to replenish what's been lost overnight. Another helpful approach is to keep a glass or bottle of water by the bedside. This serves as a visual cue to drink before standing up or beginning your morning routine. Some seniors find it helpful to pair morning hydration with another habit, such as taking daily medication or brushing teeth, to make it a consistent behavior. If you are on fluid restrictions due to certain health conditions such as heart failure or kidney disease, consult your healthcare provider for guidance. But for most older adults, consistent hydration in the early hours can significantly improve balance, alertness, and overall physical readiness for the day ahead. Skipping water may seem like a small oversight, but its impact is larger than many realize. especially after age 70, when even minor deficits in fluid can tip the balance toward weakness, wobbliness, or unsafe movement. Morning safety begins on the inside, and water is one of its most overlooked foundations. And while water supports your internal balance, your external support matters too. In the next section, we'll look at a habit related not to what you drink, but to what you wear on your feet. Let's continue. Not using proper footwear or slippers. In the early hours of the day, few people stop to think about what they put on their feet. Yet for older adults, footwear is one of the most overlooked risk factors for falls inside the home, particularly in bedrooms, bathrooms, and kitchens, places where balance is already more vulnerable due to limited lighting, smooth surfaces, or narrow pathways. Many seniors prefer soft slippers, thin socks, or even walking barefoot indoors for comfort. Unfortunately, these choices often lack essential features like grip, stability, or foot support. Without proper traction, the risk of slipping on tile, polished wood, or unsecured rugs increases significantly, especially during morning transitions when reflexes and coordination may still be warming up. Poor footwear doesn't just affect slipping, it impacts overall body alignment. Shoes or slippers with thin soles, no heel support, or uneven cushioning can cause the foot to wobble or roll slightly during movement. This shifts the center of gravity and reduces step precision, making it harder to navigate small turns or unexpected obstacles. Additionally, many aging individuals experience reduced sensation in the feet due to peripheral neuropathy, diabetes, or simply the natural decline of tactile sensitivity with age. This makes it more difficult to detect subtle floor changes, such as slight wetness, uneven tiles, or soft rugs. Without proper footwear to compensate, the body receives delayed feedback from the ground, resulting in slower correction during a misstep. Another overlooked aspect is ankle stability. Footwear with no back strap or heel support allows the ankle to move too freely, increasing the risk of a misaligned step or a rolled ankle. In the morning, when joints may still feel stiff and muscles are not fully engaged, this instability is amplified. To reduce fall risk, older adults should choose indoor footwear that provides secure traction and structural support. The soles should be made of non-slip rubber that grips well on smooth surfaces. A closed heel or adjustable back strap is essential to keep the foot in place during motion. The overall structure of the shoe should offer arch and ankle support to enhance stability, while breathable materials help maintain comfort without compromising the fit. Footwear that lacks these features, such as open-back slippers, flimsy foam soles, or loose-fitting socks, can quietly contribute to morning falls. Even seemingly minor details like worn treads or overcompressed cushioning reduce grip and increase instability. Checking your shoes regularly and replacing them when needed is an important, often ignored, safety practice. It's also important to ensure the shoe fits properly. Shoes that are too loose may slip off or cause uneven stepping, while shoes that are too tight can reduce blood flow and make walking uncomfortable. A well-fitted, supportive pair of indoor shoes, used only at home, can provide the right balance of ease, protection, and consistency for daily routines. In the broader picture of fall prevention, proper footwear serves as your foundation. It's what connects your body to the floor. And after age 70, that connection becomes more critical than ever. Choosing safe, supportive shoes may not feel like a medical decision. but it is one of the most practical forms of daily protection. With water inside the body and the right support under your feet, the next step is to consider how your joints are functioning, especially in the first few minutes of movement. And that brings us to a morning habit that starts deep within the knees, hips, and ankles. Let's take a closer look. Ignoring morning stiffness in the joints. For many older adults, stiffness upon waking feels like a normal part of aging. But ignoring this morning stiffness, especially in the knees, hips, and ankles, can significantly increase the risk of falls. The first few minutes after rising are when joints are at their most restricted. If the body is forced into full movement without proper transition, instability becomes more likely. During sleep, joint spaces receive limited movement, and synovial fluid, the natural lubricant of the joints, circulates more slowly. This causes temporary thickening or pooling in areas like the knees and hips. When the body moves after being still for hours, joints may resist full range of motion. The result is reduced mobility, hesitation in step initiation, or uneven stride, each of which can lead to a misstep. In healthy younger adults, the musculoskeletal system compensates quickly for stiffness. Muscles are more elastic, joint cartilage is more hydrated, and blood flow responds rapidly to movement. However, with age, these processes slow. Cartilage becomes thinner and less resilient. Muscles lose tone and responsiveness. Ligaments and tendons stiffen. The result is not just discomfort, but compromised balance in the crucial early movements of the day. This stiffness affects more than just walking. It can make it harder to shift weight, pivot, or recover from minor imbalance. Even small actions, like stepping around furniture or navigating a doorway, require subtle joint adjustments. When those joints are stiff and unresponsive, the body is slower to adapt, increasing the chance of falls. Another hidden consequence of morning stiffness is reduced proprioception, the body's sense of where it is in space. Tight joints can disrupt this internal feedback system, making it harder to judge foot placement or spatial orientation. This is especially dangerous in low-light conditions or when transitioning between flooring surfaces, such as carpet to tile. To reduce fall risk, it's important to address morning stiffness directly. Gentle movement before standing can help activate joints and restore functional range. This doesn't mean full-scale exercise, but rather light mobility work, such as ankle circles, knee bends while seated, or shoulder rolls, performed while still sitting on the bed or standing with support. Hydration also plays a role. Dehydrated cartilage is more prone to stiffness and friction. Ensuring you drink water shortly after waking, as discussed in Part 2, supports joint flexibility as the day begins. Combined with movement, this improves joint lubrication and prepares the body for motion. Environment can also make a difference. Sitting on the edge of the bed before standing allows time for muscles to engage and for awareness to settle into the joints. Having supportive footwear nearby and adequate lighting in the room can further ease the transition from stiffness to stable mobility. Ignoring joint stiffness may seem harmless, but it creates a chain reaction: hesitation in movement, altered balance, and reduced reaction time, all of which quietly increase the odds of a fall. And unlike some other factors, joint stiffness tends to worsen with inactivity, not resolve on its own. By spending just 1 or 2 minutes preparing the joints before stepping into the day, seniors can dramatically reduce instability and support smoother, safer movement. It's a small shift with a large impact, and one that should become routine after age 70. And once your joints are moving and your posture is steady, there's one more factor to consider before taking on the day: your medications. In the next section, we'll look at how skipping breakfast or taking morning prescriptions on an empty stomach can silently contribute to dangerous drops in balance. Let's continue. Skipping breakfast or taking morning medication on an empty stomach. For many older adults, the morning routine includes a set of prescribed medications, often for blood pressure, diabetes, or mood stabilization. However, when these medications are taken without food, especially after an overnight fast, they can cause sharp physiological reactions that directly affect balance and coordination. Skipping breakfast or delaying food intake while still taking medication is one of the most commonly overlooked contributors to morning falls after age 70. Certain medications are known to lower blood pressure or blood sugar, even more so when taken on an empty stomach. Without food to buffer the absorption, these drugs can enter the bloodstream rapidly and reach peak effects sooner than intended. The result may include dizziness, shakiness, blurred vision, or sudden fatigue, symptoms that make walking, turning, or even standing up safely more difficult. For example, some common antihypertensives, such as ACE inhibitors or calcium channel blockers, are designed to reduce resting blood pressure. While effective in managing cardiovascular health, they can cause abrupt drops in pressure when taken first thing in the morning without food. This creates a compounded effect when paired with overnight dehydration or orthostatic changes in posture, as discussed in earlier sections. Similarly, diabetes medications like metformin or sulfonylureas can lead to hypoglycemia if no calories are consumed around the time of administration. A drop in blood sugar affects both the brain and muscles, leading to slowed reaction time and reduced postural control. Two factors that increase the risk of falls during morning movement. In one review of fall incidents among older adults in outpatient settings, up to 38% of morning falls were associated with medication timing relative to food intake. The connection often went unnoticed because patients believed they were following instructions, taking medication as prescribed, without recognizing the importance of eating in conjunction. The solution lies in planning and routine. Whenever possible, medications that require food should be taken alongside a small, nutrient-containing meal, such as toast with peanut butter, yogurt, oatmeal, or a piece of fruit. Even a light snack is better than taking pills on an empty stomach. The goal is not a full breakfast, but enough caloric intake to support stable digestion and gradual drug absorption. It's also essential to consult with a healthcare provider or pharmacist about which medications require food and which do not. Some prescriptions are labeled "take with food" for a reason. Others may allow flexibility depending on the time of day or dosage. Knowing the specifics helps create a safer, more customized routine. Hydration also plays a role here. Swallowing pills with just a sip of water may not be sufficient. A full glass of water improves both absorption and circulation. It also supports joint function and further reduces the risk of dizziness or cramping caused by dehydration. For those who take multiple medications in the morning, organizing pill intake with a consistent, timed routine can prevent confusion and reduce risk. Using a weekly pill organizer and setting reminders may help avoid rushed or thoughtless consumption. Aligning medication intake with the same light breakfast each day also builds a predictable, safer pattern. Morning safety doesn't begin with movement. It begins with internal stability. Skipping food and taking medication on an empty stomach undermines that stability in quiet but powerful ways. Over time, these seemingly harmless habits can increase vulnerability without warning. Fortunately, this is one of the easiest habits to correct. With just a small shift, adding a light snack, a glass of water, and better timing, seniors can dramatically lower their fall risk and improve how they feel during the most vulnerable part of the day. Now that we've covered the 5 most common morning habits that increase the risk of falling, let's review what we've learned and how small, intentional changes can lead to lasting safety. Let's move to the final section. The first hour after waking sets the tone for your body's stability throughout the day. As we've seen, simple habits, when done automatically or without awareness, can quietly increase the risk of falling after age 70. Falls are not always the result of sudden accidents. Often they stem from small, repeatable choices that affect blood pressure, joint mobility, hydration, and postural control. This video has covered 5 common morning behaviors that may appear harmless but carry hidden risks. Getting out of bed too quickly, skipping water, wearing improper footwear, ignoring joint stiffness, and taking medication on an empty stomach. Each of these habits can be modified with simple, deliberate actions that support safer transitions from rest to movement. To reduce fall risk, consider adopting these changes. Rise slowly from bed, drink water first thing, wear supportive non-slip shoes, perform light joint mobilization before walking, and take medications with a light meal when appropriate. These adjustments require minimal effort, but offer long-term benefits to balance, independence, and injury prevention. At Health 1900s, we focus on practical, science-based strategies tailored for people born in the 20th century. Our goal is to make aging safer, not harder, through clear information and medically responsible recommendations. To stay informed about health habits that matter most after 60, subscribe to Health 1900s. Each week, we bring evidence-based insights designed to protect your mobility, mind, and overall well-being without hype and without shortcuts. Disclaimer: this content is for educational purposes only and does not replace medical advice. Consult your physician before making changes to your medication, diet, or activity routine, especially if you have a history of falls or chronic conditions.